A woman, 27 years old, first consultation on July 15, 1979. Her first menstruation occurred at age 19. After that, her menstrual cycles ranged from 40 to 120 days. Before menstruation, she experienced lower abdominal pain, breast distension extending to the rib side area, chest depression, dizziness, and reduced sleep. Her complexion was yellowish and lacked luster. She had soreness of the lower back and poor appetite. The mai was slow. The tongue was dark red in color with a thin shea tie. It was considered that the patient became ill due to emotional depression caused by 3 years of marriage without pregnancy and repeated ineffective treatments. Treatment was based on unblocking qi and shui. The prescription was based on chai hu shu gan san combined with si wu tongue. Bupleurum root, chai hu, 6 grams. Szechuan lovage rhizome, chuan xiong, 6 grams. Chinese angelican root whole, donggui, 10 grams. Red peony root, qi xiao, 10 grams. Bitter orange peel, ji qiao, 10 grams. Green tangerine peel, qing pi, 10 grams. Lindera root, wu yao, 10 grams. Cypress rhizome, processed, xiang fu, 10 grams. Licorice root powder, gansao, 3 grams. Tangerine leaf, ju ye, 15 grams. This is a daily dosage. Decoct these herbs together into a medicinal soup and drink it in 2 divided doses per day. The physician prescribed 5 days of medication. After taking the medicine, there was no improvement. Instead, menstruation was delayed by 43 days, and abdominal pain did not lessen. Breast distension worsened and became painful, with the duration extending to 5 days. However, the physician overlooked these changes and continued with the first prescription, removing jiuqiao and adding corydalis tuber, yan hu suo, 10 grams. The patient was instructed to continue taking the medicine for another 5 days. After taking the medicine, there was still no effect, and menstruation was delayed to 48 days. In addition to abdominal distension and pain during menstruation, dryness of the mouth appeared, although water intake was not increased. The patient stated that her emotional state remained stable. At the third consultation, the physician further inquired into the medical history and reanalyzed the symptoms. It was learned that the patient's mother was already 72 years old. The patient's first menstruation at age 19 was considered slightly delayed. Subsequently, the menstrual cycles were always delayed, with pale color and scanty volume, ending within 2 days. Before menstruation, there was mild breast distension. The lower abdominal pain began at the onset of menstruation. The pain persisted continuously, was relieved by pressure, and felt comfortable with warmth applied to the abdomen, stopping only 2 days after menstruation ended. The physician revised the diagnosis. Insufficiency of shui was the primary cause, and impaired flow of qi was secondary. The prescription was based on He Xiao Yao San, combined with Yi Guan Jian. Prepared Rhamania root, 10 grams. Cinnabar processed poria, 10 grams. Chinese angelica root body, 6 grams. White peony root, 6 grams. Goji berry, 6 grams. Daughter seed, 6 grams. Szechuan chinaberry fruit, 6 grams. Bupleurum root, vinegar fried, 3 grams. Atractylodes rhizome, 5 grams. And licorice root powder, 2 grams. The physician prescribed 10 days of medication. The patient was instructed to take the medicine 20 days after menstruation ended. At the fourth consultation, it was learned that this menstrual cycle was delayed by only 19 days. The menstrual volume was still scanty, but abdominal pain was greatly reduced. Breast distension lasted only 1 day and was milder. The physician considered the treatment effective. The third prescription was adjusted and continued. Prepared Rhamania root, 30 grams.
Chinese angelica root body, 10 grams, daughter seed, 10 grams, epimedium herb, 10 grams, atractylodes rhizome, 10 grams, Szechuan chinaberry fruit, 10 grams, tangerine leaf, 10 grams, white peony root, 15 grams, goji berry, 15 grams, safflower, 3 grams, and the physician prescribed 10 days of medication.
At the 5th consultation, the patient reported that this menstrual cycle was delayed by only 8 days. Breast distension and abdominal pain had almost completely stopped. The physician again used the 4th prescription and instructed the patient to continue for another 10 days. 7 months later, the patient returned with a normal menstrual cycle and all other symptoms resolved. No further medication was taken. She now presented because menstruation had stopped for 64 days. She had symptoms of loss of appetite and vomiting. Examination confirmed pregnancy. These symptoms were due to pregnancy. Notes: 1. Chai Hu Su Gan San, Si Wu Tang, Hei Xiao Yao San, and Yi Guan Zhan are names of modern herbal prescriptions. 2. Shi Tai is a traditional Chinese medicine term referring to the substance covering the surface of the tongue. 3. Shui is a TCM term. It is produced from extremely refined substances after being transformed by qi. It is responsible for nourishing and moistening the entire body, and it is also the material foundation for our mental and thought activities. Shui is different from blood. 4. Mai is a TCM term. It is the place where shui is stored and circulates. In diagnosis, it specifically refers to the pulsation site at the wrist. 5. Qi is a TCM term. It is an extremely minute, highly vital substance that circulates constantly within the human body. This includes the qi of breathing. Qi drives and stimulates various physiological activities in the human body. The cessation of its movement signifies the end of life. Some substances in the human body are constantly present, yet invisible, and some even exist only when the human body is alive, such as the qi of breathing.